Blackboard when I get to downloading them. Now, we're gonna start with the shoulder. We're covering upper extremity. We're gonna cover all passive range of motion as an exercise for each planar motion that happens at the shoulder, passive range of motion as an exercise for each planar motion for the elbow, and then I'll demo wrist and hand. When we're done with that, then we'll go for passive range of motion as an exercise for the lower extremities, etc. On Wednesday, we're gonna pick up on goniometric measurements, so make sure that you bring your book, because I'll be lecturing on goni. So bring your goni book, please. Bring also your goniometer, so we can see like how do we read the numbers and the dials on that. Okay, with passive range of motion as an exercise, the most important thing first is that you look at your entire patient environment, right? The patient needs to be able to be comfortable in order for you to be there for an extended period of time. If I'm going to perform passive range of motion as an exercise for 5 reps or 8 repetitions, the patient needs to be able to tolerate that, so I want to make sure whatever position the patient is in, I've placed for comfort. So what we're going to do is we're going to work on your shoulder today. I'll be performing all of the motion. I just want to completely relax, okay? Please try not to help me at all. All right, so with the supine position, what do we learn from week 1 in terms of how do we address patient comfort? What do I need to do?
Pillow under the head.
Okay, he has a pillow underneath the head. All right, what else?
His heels.
He needs to have a pillow underneath the knees for comfort, exactly. Okay, can you lift your legs for me, please? All right, and slowly just lay them down. Okay, so he's more comfortable. Is that comfortable for you? Okay, great. And then the other thing is draping, okay? With this comp, it's really important that you drape with minimal agitation, because you'll be there for a while, and in therapy, we only expose the parts that we need for our patient. Since I'm working on his shoulder, I'm covering everything else. Typically, we don't have too much of the towel or the sheet moving forward past the toes, because it becomes a heavy weight and can bother the toenail beds if the patient has long toenails. When we drape for the area that I'm exposing, I'm looking to just only cover the extremity that I'm working on. This will work, okay? Since I'm working on shoulder flexion right now, and I'm going to show you shoulder flexion, what do you think in terms of the pillow? Can this become an obstacle for me?
Yeah.
Yes, because we know with shoulder flexion, the arm goes all the way, right, to at least 180 degrees. So can you lift your head for me? All right. On the comp, you'll be responsible to think about that little consideration. Remove the pillow out of the way so that you can also perform full range, okay? We want to make sure that the patient is close enough. This is good. If my patient were further away from me, I can ask him to scoot towards me a little bit, okay? All right, per minor, what they have is, if you look in the book, it'll show you, for example, the joint. This says shoulder or glenohumeral. First one is flexion. Patient's position is going to be in supine, all right? The therapist is going to place one hand on the, supports the arm and grasps the wrist and the hand, okay? So this is one where I said you're going to have a crossed and uncrossed position. Hands crossed and your end position is uncrossed, okay? So as a therapist, widen and stride my feet. Okay, ready? Beginning position, it must look the same. End position. I don't know if you can see the end position. He's resting on my forearm. Okay, I'm kind of just cradling it just a little bit. Beginning position.
Crossed.
Okay. Crossed. My head is directed towards his feet, right? End position. I'm in line with the direction of the motion. Okay, beginning position. End position. If I had to do this 8 times, I'm on number 4, beginning position. End position. Okay. You're not going too fast, and you go as slow as the patient needs. Okay. That's flexion. All right, any questions? Okay. All right, I'm doing like a pivot motion, all right, of my feet. I used to tell the students, like stand alive. Stand alive in terms of how your feet are moving, okay? So you want to think about it in this way. Now for extension, the patient has to change position. So the patient, can scoot towards me, click a little bit. Extension, it is not okay to have the patient scoot and then we just drop the arm for extension of the shoulder. We actually have to turn the patient to a sideline position and then kind of work parallel with the table from there.
Mm-hmm.
So what I'm gonna ask you to do, please, is if you can just let me remove the pillow. Okay, bend your knees for me. Can you roll towards your side for me and face the window? Okay. In a sideline position, where do I place the pillow?
In between the legs.
In between the patient's legs. Great. Can you please lift your legs for me? Are you comfortable?
Yes.
All right. For this arm that's on the table, if you want to, you can kind of just put it on your side for more comfort. Is that more comfortable for you? All right. So again, I'm only exposing the joint that I want to work with. Are you comfortable?
Yeah.
Okay. All right. So for shoulder extension, this is the beginning position. It's important that your patient isn't rolling too far forward or too far backwards. They just need to be perpendicular to the.
The main position I saw was in PROM. Would this be just sidelining for the comp?
This is following the minor and minor book.
Oh, okay. Because on the videos, yeah, I just saw it in PROM. It was like this.
No, what you saw was for goniometric measurements.
Oh, okay, that's what it
And I'm
was.
glad that you brought that up because oftentimes you guys get confused about passive range of motion as an exercise, and then when you're actually using that tool to measure how much available range is at the patient's joint, okay? Right now, I'm showing you passive range of motion as an exercise, so that can be what's in your head.
Okay.
And then on Wednesday, after you finish comping, I know I have your brains for the more complicated stuff, okay? Yes?
We don't need to drape the back of the patient.
No, this is fine. You wanna cover the patient enough. This will work. This is actually covering him all. This is good. Okay, this is good. All right. So for beginning position for the shoulder, you're gonna stabilize right at the elbow joint, and also stabilize at the distal segment with the wrist in neutral. We don't want to drop because we're not putting the wrist in flexion to create compression at the flexor retinaculum. Okay, we don't want to give them carpal tunnel. All right, beginning position. Do you see where my legs are, guys?
Yes.
Mm-hmm.
Do you see how I'm slowly moving to the end range? Because I'm not going for a stretch, just the available range, right? End position. Beginning position. End position. My patient is helping me a little bit, so this is where I would say completely just relax and let me do all the work, okay? All right, beginning position. End position. Beginning position. End position. Last one. Beginning position. It's kind of like I'm a door, opening up the hinges of the door, right? End position. Do you see that I'm pivoting just on one foot? It's just the lateral, I guess the outside leg, if you want to think about it, is just swinging open.
Yeah.
Okay, Bernie, don't fall asleep on me on this one. You need to pay attention. Okay. Yes.
I have a question. On the right side of the patient, would that be like the leg, the right leg, like would it be like?
On the right side. On
Yeah,
the,
like since you're on the right side, is that why you're moving your right leg?
Oh, because I'm on the patient's right?
Yeah.
Well, I'm addressing the right arm, you're correct. Actually, we need to move him more this way. We must be behind the patient.
Right.
So you wanna be in line with the motion. There's no other way to be in line. You can't be here because that's bad for the back
Right.
mechanics, right? This is the way to keep the back in good position, right? Good body mechanics, and I can just work with the arm. So you're just behind the patient on this one.
Okay.
This is
I just see that you have your left one still.
oh yes, that's, I'm just pivoting. You need to
Right.
pivot, yes.
But on this side, you would be pivoting with the opposite, right?
Well, yeah.
That you'd be moving the left since you're on the left side of the patient.
If I were-
doing
If we were like up this side of the
This side.
plane.
If you were doing
And
his
then-
other.
Okay, so if I were using his
Yeah.
left?
Yeah.
If I
Yeah,
were
on the
working
left
on his
side,
left?
you'll be moving your left leg, right?
Yeah.
Okay.
You switch
Yeah.
sides, you switch legs.
Yep, I can see that, yes.
Yeah.
I have a question. So you go slow, because right when you start to feel like that resistance, like that point where they can go, that's where you stop.
We're stopping just before that.
Just before that?
Yes. So as I'm moving slowly, I'm able to feel
That
the
resistance,
tissue.
that like
There shouldn't be any resistance, but I can feel that I'm getting
getting
towards the end or near end of the range, and I'm stopping just before. He actually has, of course, more motion. You see how much more motion he has available to him? But I'm not actually going for a stretch. Do you feel like your arm is being stretched a little bit?
Yeah.
Okay, that's a stretch. Plan of care is for passive range of motion as an exercise. So I want to go for what's available, where the tissue is unrestricted, like how the lab.
And you'll feel like you'll
like
feel
right here, it's starting to get a little heavier, a little bit more.
kind of like just like a little bit like kind of resistance, a little bit.
I would say if you can call it a resistance, yes, just a little bit. But you want to be careful in using that word resistance, because really, truly, resistance is
It's like
felt
at your max
at
point,
the
yeah.
end when you're with a stretch, and that's
Yeah.
when we're talking about using that word resistance in X1. But here, what I'm feeling for is that the tissue still feels nearly the same as it did in the beginning of the range, free and available to move, no restrictions.
Okay.
I thought that too. That was the question I asked in the starting class.
Uh-huh.
I
Okay.
thought the same.
All right, so this is the third motion that I'm performing now, which is shoulder AB deduction, okay? So for shoulder AB deduction, the patient needs to be in a supine position. I'm going to just remove the pillowcase. And I'd like for you to please just go ahead and lay on your back for me. What do I need to do in terms of placing the pillowcase for patient comfort?
Under the legs.
You got it, exactly. All right, so if you could please just lift your leg for me. Thank you. All right, and you can rest your legs. Are you comfortable? All right, I'm still, planet care is asking for the right shoulder. AB deduction, passive range of motion as an exercise. Per minor, patient is in supine. One hand is going to support the arm. The other hand is going to grasp the wrist and the forearm. We want to avoid shoulder flexion and medial rotation, okay? We want to permit lateral rotation to avoid impingement. This goes back to kinesiology. My beginning position, I'm supporting a neutral wrist at the distal segment. I'm supporting also the elbow, okay, as far as the proximal segment is concerned. Start position, beginning, okay? In position, I'm laterally rotating the arm to prevent impingement, okay? Of which tubercle? In the shoulder, the greater,
Yeah.
right? Beginning position, okay? Look as I'm going into AB deduction. In position, you see at some point towards the lateral portion of the AB deduction, George, right? That the shoulder is rotating, okay? So that the greater tubercle can actually get out of the way.
So the beginning is palm down, and then as you work your way up, your palm
That's
gets up.
correct.
Okay.
Beginning position,
Palm down, and then as you're okay.
rotation in order to allow for the greater tubercle to not get stuck under the acromion process in position. So beginning position, this one happens to be an uncrossed in terms of the therapist's hand placement, right? End position turns out to actually be crossed as the therapist's hand placement. Okay? And you see the pillow is still out of the way so that we have room for the AB deduction, okay? As you want to move into the AB deduction, move this arm parallel to the plinth and the floor as much as possible, okay? Because we want pure planar motion, all right? If I was going to do this here, that's a partial flexion. This is not AB deduction,
Yeah.
okay? This is why I'm moving parallel with the floor. Yes, hand, beginning position,
For the shoulder, it's always one hand on the wrist and shoulder.
end position.
Wrist and elbow.
So far, yes.
And you put your hand, you put those hands there because you don't want them to activate any muscles to hold that parallel.
Because we want to make sure that we're supporting the arm. Usually the proximal segment is going to be the segment most proximal to that joint, and then the distal segment is going to be the segment most distal, right, to that particular shoulder. So you're stabilizing in the proximal and a distal segment
Yeah, and
relative to the joint you're
but
working.
the purpose of it is so that like they
For
they can completely relax, because if it's not, then
He
they
can
have to
completely
use.
relax if I have my hand here, right?
Yeah.
But this offers the most stability and comfort for the patient, so that they won't have any pain. It's more than relaxation. We want them to not have pain.
And like, but let's say you didn't have it on their elbow, you only had it on their wrist, then they would have to like fire muscles to keep that parallel. Exactly, they would have to fire muscles to keep that like parallel, which would not make it passive.
The arm can feel very unstable. And so whatever that would mean for the patient, not just firing muscles, I don't want to focus just on what you're saying because it's more than that. It can be pain, right? It can be you're causing micro trauma, right, to the joint because it just had surgery and that's causing a little bit of instability, which is causing a pull, right, on surgical structures, structures that were just, with surgery. All right, so what do we do here? We did flexion, right, in a supine position, pillow underneath the heels, right, underneath the calves, sideline position for the patient to perform shoulder extension, right, and then we put the patient back in supine to perform abduction, all right? And then keep in mind the pillow to keep the shoulder so that it's free to move unrestricted, all right? Let's spend exactly 7 minutes practicing these three, okay? And then we'll move on to other shoulders. Okay? Your lab partners are there. Okay, thank you. Is this All right, time starts now.
I guess.
Make sure you spend the time to allow both to practice. You should do 3 repetitions and then move on to the next one. Leave it there, but shoes completely underneath the table.
Yeah, 2 more for those. Thank you.
Ready, you're being patient first. Yo, that boy burning. Yeah, we did pick the big picture, so you want to do Yeah. Okay. Alright, so raise your leg. Here we go.
Which one do you want to do?
So right.
Right?
Yeah.
So we're right here, you can do shoulder flexion. So before shoulder flexion, is the pillow gonna go to the right?
Okay, you need to drape your patient, it's cold.
Oh, okay. Yarn position.
Watch out with that.
Verbal cues for this comp are usually about speed and forgetting to drape your patient.
Minimal agitation.
Right here? That's fine.
And make sure with the pillows that you're allowing for full range of motion of that joint.
One more.
Good job.
Just do 3, I guess.
Light
You
on
shouldn't
your
have to
feet.
remove your hands, Jose, from the patient. It's beginning position, end position. Cross,
Yeah.
Cross or crossed?
cross,
The footing is what I guess.
cross. He's trying
Look
to
at cross.
Sure.
Here,
Push back in the beginning position.
here,
Right here. Cross,
here.
uncross. And you're literally, the less twisting you do for your back, the better. That's why I'm twisting at your case.
Support that elbow.
Slower.
like switch your grip on the elbow when you go up?
Start cross. With your hands crossed.
Oh, I see. So start like this.
There you go.
Oh,
do,
like this.
Cross your hands.
Or reverse.
There you go.
Actually, yo, finish it.
Yeah.
We're already on the supine. Abduction.
In position.
Yeah.
Getting slower, guys. Slower. Watch your breath. Yeah. Extension.
And then you're like come. Little arms. There you go. Like no feeling.
Makes sense.
There we go.
Beginning
Like,
position.
raise the
Where does
tension
your
there.
support go?
So
It is pretty
palm
relaxing
up
when I let it render.
when it's up here, but then palm down when it's
For the therapist too.
Look at the book.
Pretty dumb.
In position.
Relaxing.
No, it's not. We're doing abduction.
So
AB
was abduction in this
abduction.
position?
Well,
Abduction, yeah.
the guy was a super. Yes, ma'am.
Feel like I got it.
Now abduction, it's already in
40 minutes.
So abduction.
Watch me. Beginning position. Like a door hinge.
Opening the door.
So,
So you walk with the first time.
whatever shape
You
of
walk
the
along.
place. And then like this. You're doing a step back and step forward.
One foot, then back.
Roll. Good. As a therapist, you should not be taking more than one step for abduction. When you open your legs like a hinge, your body like a hinge of the door, beginning position, open the door. Beginning position, open the door.
Alright, then you're good.
So you want to practice?
No, no, switch. Yeah, I do, but just switch.
More
Is that
finesse.
So,
Yeah, slow down.
one foot forward, good to go.
We're good?
There you go. But I asked you the question, George, when you're performing the abduction, you're on course, you're right, guys. But there's more of them.
You have to keep it parallel.
So,
That?
yes. When you're here.
That's when you step across.
Oh.
Step back.
Yeah. Ah. Sorry, I'm so sorry.
So sorry.
Is there anywhere in transition from like all the way back into like the what's that? Alright.
I'll show you.
So
No,
starting from
I'm, so you're here, and you just have to make that pivot back. Like, really, really control your own body, make that pivot back, ready to.
Step forward, step back.
Yes, so like you're sitting down.
Do you want to?
This, none of the fit on the middle.
And then kind of sit.
You know, I mean, we're
There you go,
You want
that's
to?
it.
that is like Tai Chi.
That is.
That's
So
crazy.
you need to
Yeah.
just- okay.
Out of the way.
Alright, you should be switching now.
Alright, you just gotta
Switch
imagine
partners now.
There you go.
Alright, have your patient.
Sorry, you pick. Or whatever, you want to do. I want it easy. I want it easy.
Minimal agitation for that one. Closing?
Toast.
Beginning position. Beginning position. In line with the direction of the motion. Beginning position.
All the way down.
Good.
Yeah.
And end position.
Yeah.
That's it.
And then when you come up,
That's it.
it'll feel good, right? It'll feel like right. Oh.
Beginning position.
And then the other thing that you can do is
Now,
To have more
down,
space.
that way you have more.
Yeah, right.
Bring them closer, a little bit closer to you. Stretch, come
A
a
little
little bit
bit
closer to
closer.
you.
are you over this one?
You have to like eventually turn it.
So, but my hands are starting correct.
So you're not twisting your
No,
elbow.
over here.
You're
Save your backs. Save your backs. Use your legs. That's it. That is it, Gianni, right there.
Yep.
That's it. Can you do that a little bit slower though?
Yeah.
More skillfully? With finesse? That is it. We literally have to go slow like this, guys. Your patient just had surgery, and you're in the acute care setting. The nurse gave them a pain medication only 30 minutes ago, and it's just taking off the edge a little bit. It's still really painful, right? So we have to go slow and gently. All right. Now, I ask you, hello. I think that will offer still stability for his head, and then when you move, you have a.
I'm doing, oh,
Beginning position. I'll get out of the way so you can.
All the way through.
He is actually a little tight.
Yeah. You got it?
Remember, switch your hand. Yeah. Leave it there.
It's like this.
No. Yeah,
But
rotate.
how are you gonna position yourself a little bit?
This one, you-
See that you're in
Or
position.
this for the.
No,
Yeah.
like
What's
this
your
one,
hand?
step back, something like.
so here,
So he landed it.
or a little closer.
Practice extension,
No.
Yeah.
but that we can't do.
That may work. That may work. Yes.
As well, sun.
Supinated. That's a great question. Gianni asked about his hands in terms of hand placement. As therapists, you always want a supinated grip no matter what, right? As much as possible. Sometimes it's not always possible. We want to prevent compression, right? Carpal tunnel issues. So it's always going to be a supinated and a neutral wrist. Yes, let me check.
That's
Here.
what it was.
So like this, and then you want palm up.
That's a good rotation. And you're so tall.
Yeah.
Yes, yes.
Got these.
So for you, let me just go ahead.
Yeah, I think supposed to be compared with like the
Your
English.
back gonna be
A little bit wider. To get lower.
beginning position.
Yeah. Wait, look at that.
Are you doing right now? Oh, no,
Yeah, it was like this.
No, I think.
Gotta bring it up.
When you get to that point, you start.
But I forgot that the foot moves, the foot position.
See, they're gonna be rotating.
That also.
Yes.
It's a good rotation for me to get. They have full control of the position from the start.
It was like the same pivot kind of.
Yeah, it's a little dress.
Yeah.
And then your wider strike will allow you to
I'm gonna get a massage now.
Yeah.
I think we
Got
got
you. I'm gonna get that knee
Like,
massage.
hold it like here, like.
Your verbal cues is gonna be.
Or was it just elastico?
It just depends on the patient.
Elastico.
For example, close it, like when I close it, you still have a lot more to do.
Sam, you had a question?
Yeah,
This is elastico.
that was the
Flexible.
shoulder flexion, you said that it was opening here, but I don't know, I found it better, like.
I said, no, we're not gonna use our phone, but we're gonna do exactly like how
Ah.
the experts have taught us how to do it, right?
Mm.
Alright, so beginning position.
Oh, sorry.
And then I'm opening up like a patient relax
So
completely.
it's like a.
There you go. Beginning position. And position. Patient relax. Happy, just close your eyes. I'll do all the way. Beginning
Just
position.
turn to your side now.
And position. And for my patient, this is about as far. I could go, but this will be more of like stretch. You can feel that right
Right,
here, right
yeah,
here,
it's just
right?
a tense
Push it,
Kind of tight
exactly.
there too.
Exactly. So beginning position. In position, yeah. Kind of looks like a Tai Chi, a dance, whatever you want to call it, right? But therein is where the skill lies. And that's you, the therapist, the patient's like, I want that therapist who is very gentle with me. It's more than about being gentle.
I know.
You're really paying attention, and I'm actually in sync with the patient's body and motion. Okay? Okay. All right, great. Jose, Jose, do you wanna continue to be my patient? Thank you. So we just covered 3 motions. I like what I see so far. Next one we have is shoulder, horizontal, ABD, and AD deduction. What direction is horizontal, ABD, and AD deduction? Exactly, coming across, you've got that right, ready. So for this, the patient needs to be in a supine position. All right, just wanna lay on your back for me, please. And I'm going to place the pillow underneath the patient's legs. Go ahead and relax for me, okay? Sometimes as a verbal cue, I'll tell you, it's cold in here, right? Oh, that's right, drink the patient.
Chilly.
Yes,
Will it count as a verbal cue?
yes.
Oh,
Yes, sure it does.
Oh, there's the draping motion for the patient being cold.
It's for a patient being cold and comfort, because what you'll see is usually when we're draping like this and doing range of motion like this, it's in the acute care setting. And if I'm using, for example, the hip or the knee,
Right.
gown exposes everything, right? So you'll see when I get to the hip and knee, I'm like wrapping. I'll show you how I kind of wrap
Right.
so that we're not, even if anybody's looking, you don't see anything there, but the sheet, right? Okay.
Got it.
All right, so horizontal ABD, ADD. Okay, so we're again addressing the shoulder. This is your begin position. I actually have to have my patient a little bit closer. If you can scoot towards me a little bit, if that works. I want you to relax and I'm going to do all the work. Horizontal AD deduction. I'm moving towards the midline, right? All right, here, beginning position. What can I do with my toes? Your feet. End position. I am in line as a therapist with the direction of motion. Horizontal ABD deduction right now, right? ADD deduction, end position. Beginning position. If the end position is horizontal, AD deduction, end position. As I am in the end position, you see how his forearm is resting on my forearm. It's completely supported, right? I'm not like this.
Right.
Okay, I'm cradling. Whenever we have an opportunity to kind of cradle the arm, like football or however, that's supportive for the patient when they have the surgeries. It helps them. Just relax as much as you can. If the comp said horizontal AB deduction, this is my beginning position, right?
because you have to go back.
Exactly. Beginning position. Look at my hand that's on the elbow. End position. Beginning position. You want to see, Joanna?
Okay, so your hand moved over. Okay.
End position. Okay. If it was horizontal AD deduction, I'm starting here. Beginning position. End position. Okay. Horizontal ADD, ABD deduction. All right. The next one. The next one we have is medial lateral rotation at 90 degrees. Passive range of motion as an exercise. So the patient has to be actually in 90 degrees. All right. Of glenohumeral ABD deduction in order for me to go medially and laterally rotating down. Just give me a second. Okay. All right. So beginning position for medial and lateral rotation, the glenohumeral joint is at 90 degrees. Okay. I'm stabilizing at the patient's elbow. I'm also stabilizing for a neutral wrist. I have to be in line with the motion. So because I'm in line with the motion, I can tell that I'm actually going towards medial rotation this way, right? Okay, here, beginning position, end position, medial rotation. Beginning position, end position, internal rotation. Beginning position, why do I keep adjusting my hand? You want to make sure, remember about the funny bone, right?
Right.
Okay, we don't want to disrupt that. So don't hold on to your patients like this, please, okay? And just gently supporting, okay? Beginning position, end position, it's medial rotation. I'm in line with the internal rotation direction of motion. If this were external rotation, I am in line now with the direction of motion, okay? Beginning position, in position. Beginning position, in position.
So this one you don't even move your feet.
I just had to pivot, literally, it's
Oh,
just
okay.
this, staying alive again, okay? This is like, what you guys see me doing is I'm just using my body very energy efficient. Because if I have to be here like for 10 reps on the whole body, right? Motor vehicle accidents, multiple joints involved, you'll be there for a while. On a heavy limb, right? A patient has heavy limb, it's hard work, you'll be sweating. So I'm just being very energy efficient and watching my mechanics at the same time. And I'm sharing that with you too, okay? And how I'd like for you to use that so you don't hurt your backs. Okay, so that shoulder, what do? Horizontal ADD, horizontal ABD. We did medial rotation, okay, beginning position, in position. We did beginning position, in position for lateral rotation. Now from here, I'm gonna go into elbow flexion. Let's see what the book says. Hold on a second, Okay, for the elbow flexion, the patient is also in a supine position. Can you scoot a little bit more towards the middle? I want his arm to be supported, right, a little bit more. All right, so beginning position, the arm is actually in a supination, right? Forearm is in supination. Beginning position, in position. I'm in the direction of the motion. Beginning position, in position. By having his elbow resting on the mat, that's the stabilization versus my hand. Beginning position, in position. Elbow flexion, beginning position is in extension. We're ending in elbow flexion and position. Okay. All right, any questions? Okay, let's spend 10 minutes. Thank you, Jose. Efficiently working on that. Okay, we have those three.
Since I already have my shoes off, I'll be
TikTok got a crazy trick on that.
So it's goodbye for all of you. You already know, bro. The number one patient.
That's pretty sure. Yeah, I see it.
Sleight of hand. Okay, so.
Horizontal.
Snakes on the plane.
Beginning position.
Yeah. Elbow.
You're choosing how like beginning position.
Flexion, bilateral.
Move this hand. In position. Beginning position. Support it.
So if you're in line, is it better to go with
What's up?
Yes. Beginning position.
the movements?
And you're reaching over.
Yeah.
Horizontal ADD. In position.
With elevation.
Beginning
With
position.
the line of movement.
In.
Yes.
You got it. Mm-hmm. You got it. That's it.
Alright, and now the other way. Okay, pretty good.
So now
Okay, horizontal A, BD, ADD, then we went to, what else? Medial lateral rotation, then we went to the elbow.
Yeah.
Flexion.
I'm gonna be more on the edge.
By the way, is it okay?
Put the pillow underneath your patient, look at that.
already,
I go back after.
We're
This
beyond
hand
this,
here.
right,
right?
That shows there.
There you go.
very,
Okay. We're remembering this as part of skill.
Medial.
Yeah, I shouldn't see that.
Professor, does the hand
Oh,
go in
that's
front
right,
or in the
this
back?
goes up.
Okay, so beginning position, looks good. End position, looks good. You wanna keep his arm,
So,
yes,
so,
at
so,
90.
oh,
And then beginning position,
acceleration.
end position. Beginning position, lean into end position. Beginning position, lean more like your legs.
Like a lunge.
If it's
like a
coming from
forward.
your back, you're exercising your back, you can throw it out. If your
What's
patient
that?
decided to
What's
pull his arm away from you, he'll throw your back out in the way you're doing it. But if you use your legs,
You
you'll never
doing
put your back
obstruction
in the
or
process.
you use?
yo, my business is the
You felt the
Full extension,
Yeah, it's more on my leg than my arm.
and then full flexion of the elbow.
Alright.
Now elbow.
That's two though. Now.
No, we did that in lateral and then
Internal
medial.
So now you do elbow flexion and extension. Medial lateral rotation at 50.
Yeah, I
Elbow
know.
flexion extension.
We haven't done that.
Okay, so you're gonna do that.
Yeah.
And then
What's the patient
horizontal.
Double flexion.
How we stand?
But first one, we had
Patient is
that.
supine, forearm is
You feel
supinated,
the cramp?
therapist goes in the direction of the movement.
Just seems like a different infield, because your lever's a little bit
So
longer,
the direction of the movement.
but you still have a soft.
So,
But yes, I did feel the crack too.
Yeah.
Internal.
Medial lateral rotation, shoulder horizontal abduction and AD deduction, and elbow
So
flexion.
George, as you go into the flexion, neutral wrist for the patient, we don't wanna compress the medial retinaculum.
So,
Couple
no,
times.
not supinated, right?
You're doing this to him,
Oh.
keep the wrist neutral. Keep your patient's wrist neutral.
Hold their hand.
You're holding it across the wrist, not the hand, because the hand you can yank it and pull it, so then it's a distraction problem that you're creating, right?
Okay.
Yeah, you're holding it across just like alpha custody, across the wrist.
Got a nice good face.
Put it into supination, right?
Sorry.
George, full supination when you go into the flexion.
Okay.
Good face.
Alright, put your hand all the way to the same. This one?
Alright, we gotta make this look good, right? At this point, I expect to make it look good. Things need to look good. You do, right? What? So what do we? Okay.
No, wait, actually, AB.
Horizontal? Okay, so bring it out, okay? Rest his arm. And he needs to actually get a little bit closer towards you because we want to allow the arm to drop. Can you scoot more? There we go, so you can see like the shoulder being here and then the rest of the arm just hanging out. In line with the motion, so you're gonna
It
do
really is just that
this way.
thing.
Okay, if you're like this, that throws your balance off. Good. Beginning position. And you got it. Beginning position. Get out of the way, Supreme. Put that on your arm. Beginning position. That's it. And beginning position. Yeah.
And this will be
Position this.
Beginning position.
Yep.
And you're compressing.
And you rotate.
There you go.
After elbow flexion,
Now you do the horizontal.
There you go. You protect your wrist
So,
that way.
can you scoot more to the edge?
and we have to tippy toe it.
At the end of AD deduction, horizontal AD deduction.
The-
Horizontal AD deduction and horizontal AD deduction.
No more heads.
So that you're gonna do one at a time.
Medial.
We'll sub up.
God damn, man, you see it.
I forget I was an old man.
It's been a while, bro.
Tense old man.
I better get a whole hatter.
Tippy toes.
Oh, yeah.
Never heard it. Alright.
Holding it like a football. The forearm should be held like a football.
Right here?
your legs. I mentioned about having your stride and all the movement, really the motion coming from your legs. If the patient jerks his arm away from you, is aggressive in any kind of way, that can always throw our back out if we're using our back.
So my back leg is just, my front
Anytime
leg
you
is
use your
just
legs,
work.
you're always able to, the patient can never put
Pulling
their
me,
back up.
pushing me
But
forward.
the patient has
Like
the
that.
patient has traumatic brain injury,
Nice.
and you have to perform this. They have personality changes and get very aggressive depending on their anxious level. Right?
Yes.
So you have to always
That's
so
good.
that nothing is a surprise to you. You're in check. You're there you go. And take a side to the disrupt. Alright, so everybody had a chance to practice? Okay, let's move on, please. Alright, Jose, if you don't mind being my patient, we're gonna move into forearm pronation. We started with the elbow for flexion. Now we need to do forearm pronation and supination.
Story of my life.
Okay, so you wanna just, okay, scoot all the way back.
Hey, Vernon.
I like to see you taking. I like to see you taking.
Alright, I'm still remembering to drape my patient, as you can see with the pillow. You just wanna make sure you have the pillow such that the heels are not covered by the pillow. They just need to be free floating a little bit, okay? I'm not gonna cue you on, or, you won't fail if the heels are touching the mat. I need to see more of the calves supported and behind the knee. That's more going towards other conversations, other classes. Okay, here we go. Patient's body is covered. I'm working on forearm pronation. So literally, the forearm is now exposed. All right, per your book, Johnny, do you mind reading? Because there's a couple of
Yeah, of
points here I
course.
want to make sure that you guys hear.
Okay, so one hand is gonna stabilize the arm. The other hand grasps the distal forearm and supports the hand.
All right, so we can be here. That should be fine. All right, so what I want you guys to do is to start in the forearm neutral position. That's your start position. Your beginning position is forearm neutral. Which one are we doing? Pronation first. Beginning position is forearm neutral, okay? End position, full pronation. I'm in line with the direction of motion, right? Beginning position, patient, allow me to do all the work. End position. Beginning position, end position. Okay. Going into supination. Beginning position, I am in line with the direction of motion. End position. Forearm neutral is my beginning position. Supination is my end position. Beginning position, end position. All leg work. Okay, beginning position, end position. Beginning position, full pronation for pronation. Okay? Alright, so that is pronation, supination. Alright, the next one we have, I'm moving over to the wrist. Okay? So for the wrist, you mind reading that one for me? Here we are, flexion and extension. Okay. What position is my patient?
So you're gonna have the patient supine, the elbow flexed, and the fingers free to move.
Okay. Before I move into the wrist flexion, let me just make a comment about the book. Sometimes we have to look and see the book, they're using it, the optics are more for teachable moments, but not exactly the position that should be. I think for the pronation, the way that he has that one, he had the arm maybe up a little bit so that you could see, okay?
Yeah.
All right, so remember to please put the patient's arm down onto the mat, and then just move into your pronation, into your supination. You'll see if you get the book, there will be opportunities where they're doing it more for the optics than the actual correct position. Okay. All right, so wrist. Okay, wrist flexion. Elbow flex. What else are we doing?
Elbow flex, fingers free to move. One hand stabilizes the arm and forearm, and then the other hand grasps the patient's hand.
Okay. This stabilization of the forearm is this hand position. From kinesiology, what is this hand position called? When you have flexion of your MCP joints and extension of your pips and dips and thumb opposition.
C.
And it's how
The
we.
Z position.
the
Z pose?
No.
Z.
Still the C.
Starts with
It's kind of a
T, I
grip.
think.
Starts with an L.
Secret?
Oh, a lumbrical.
Thank you, lumbrical grip, because it's your lumbricals that are creating that motion. It's your lumbricals that allows for, when my lumbricals contract, that's flexion of my MCP joints and extension, literally, of my dips and my pips, okay? So, lumbrical grip is how we handle our patients. Lumbrical grip is how I have my patient at the wrist as well. Neutral wrist, begin position, end position, we're working on the wrist. Beginning position, neutral wrist, end position, flexed wrist. Beginning position, patient relax, allow me to perform all of the work. And end position, wrist flexed, right? Let's go into wrist extension. I'm switching my hands. Beginning position, end position, right? Beginning, if you notice with the wrist flexion, my hand was here to support the bottom of the hand as it moves into flexion to support, right? Same thing, I'm switching, my hand is at the bottom of the wrist to support the wrist extension, okay? You're not here, okay? The hand, your fingers, your forefingers 2 through 5 on the dorsum of the wrist, okay? Palmar surface of the wrist. Beginning position, end position. Beginning position, end position. Therapist is in line with the direction of the motion. Beginning position, end position. Okay, moving into extension. Elbow is still at 90 degrees. Just want you to relax the patient as much as you can. This one here should actually be here. Beginning position, end position. Much better. Beginning position, end position. What's different now with my flexion? One second, guys. It's supposed to be here. Beginning position, end position. Beginning position, here. All right, for flexion. Beginning position, I'm in line with the motion. It should be here.
And this was called what? If you switch sides like that?
If we switch sides.
Because you were like, you started here and now you're
Oh,
here.
well, I actually had started this way, flexion this way. I'll accept I've seen it this way. The extension, I switched my hands because I want to see extension of the wrist.
Okay, but you can do it both ways, the extension.
You can, what I'm saying is that you need to have the palm of your hand on the dorsal surface of the patient's hand when you move into extension. End position. Beginning position, end position. All right, we're pretty clear?
Yeah,
On that? Okay, all right, so that was wrist. So what did we do? We did pronation, we did supination, wrist flexion, I'll take it that way, I'll also take it this way, it's fine. Wrist extension, we'll take it this way, okay? Won't work any other way. Take it this way, it's fine.
Wouldn't you switch hands though? Because
Yes, wait, hang on. Flexion, flexion, yes, extension, extension. You would switch it, okay? All right, and let me see if I can squeeze one more out for us to practice. Let's see. Oh yeah, flexion, so let's do the radial and ulnar deviation. Radial and ulnar deviation, which should be here. Do you mind reading for me?
of course. So you're in the same position, elbow flexed, forearm in mid position. One hand stabilizes the forearm, the other hand grasps the patient's hand, and says range of motion for radial deviation is less than for ulnar deviation. Avoid wrist flexion and extension
Yes.
and pronation, supination while performing the deviation motions.
So what they're saying is keep the forearm in neutral when you do your deviations, right? And it's also saying keep the wrist in neutral, right, when you're doing your deviations, right? So Gianni also read something that was really important. He said that there's less motion with the radial deviation than there is with the ulnar deviation. Do we remember from kinesiology why?
Because of the silent process.
Yes, you got it, because of the silent process. All right, beginning position, end position. Beginning position, end position. What am I performing? Beginning position,
Radio deviation.
end position. That's right. Any therapist, you guys therapists from across the room can see exactly what I'm doing, right? Beginning position, end position. Beginning position. Patient, just relax for me. Beginning position, end position. Patient wants to help out. Beginning position, beginning position and in position. And even I'm standing here, I'm still I'm still like with a wide stance.
Sorry. This is the only one that I noticed that we haven't had our hands in supine.
Yeah, but, okay, so so the hand's not really supine, there's no possible way for that. But what is important is that the therapist has like a neutral wrist, like your wrists are not collapsed in any kind of way of flexion, right? You're in a neutral position. Okay, all right, let's work on those. All right, we'll spend 10 minutes doing that.
I'll be there.
Thank you.
You don't hear me, I'll be there. Be there.
Repeat it?
Okay, 3 times. One.
Danny's funny.
No way, Jose.
That boy, hold it up.
Yo, let's scammer, bro.
Let's scammer.
Let's scammer.
Alright.
Do I have a deal for you?
No, man.
Get the gift card then.
Hold it, let's scammer, dog.
Yo, that was incredible.
Alright, what you gonna do first?
That has not been affected since
Okay, time starts now.
Don't play the scammer, dude.
Hold it, let's
Thank you, sir.
scammer. Good PTA.
Brings the next week.
What goes underneath the legs?
I thought I had it this time. But it'll take 15.
Remember what I said about the sheet at the feet?
Yeah, one
One of the two.
No. Move back, move up, move up.
Yeah, move up slightly more. Your feet are hanging too much.
You gotta turn with
A little more.
the motion. You know?
Maybe bring the others will make it easier.
Start in neutral,
Do everything
because
yourself.
your plantar care may just say, for example, supination only, right? Passive range of motion as an exercise,
do
perform
one thing,
supination
can-
equally. Exactly. There you go. Very good. So Daniel, your plan of care, okay, now I can see, your plan of care says pronation, right? Passive range of motion as an
Is this
exercise.
flexing right?
Good.
I'm trying to do pronations.
And then if I want supination, I switch the verbs.
Yep, you got it. Just taking pics, guys, for your, pinning ceremonies.
Causing an Indian burn on the patient.
Like,
I remember those as a kid, dog. I remember those when I was little, those are the worst.
For extension, because the 4 fingers have
Isn't
to
there
move.
wrist flexion extension?
SUSSC?
No, I already did that.
Do you do ulnar and radial deviation?
No.
And then for flexion, is it C? So you switch hands and go from flexion
I
to
did.
extension, right?
I did.
Yeah.
There's always.
'Cause,
Flexion, good,
and then for extension, let's see.
just this way.
You see,
There you go.
yeah, because the
Starting at
4
which-
fingers in your palm have to be under.
Yeah.
Oh, okay.
And you're moving in direction.
slower?
Sorry.
Better right there?
Pronation.
Pronation.
I guess that would be bad. Murray was not a smart movie, honestly.
But it's with the quick rate of deviation.
That was kind of dangerous.
Exactly.
Alright. Supination, pronation. Hit you with the quick tension first one. Now I'm gonna hit you with the. So for radio, one of deviation. Yeah.
Because I don't think I see it.
when you hold it like that,
You can rest for now.
there you go.
Yo,
What if I go going? Going?
No, I don't think, no, but then you, yeah, look,
come to your patient.
you see, I can't remember what.
Did you guys finish?
I want to ask for the video on the DVD.
Okay, time to
Just
switch.
do, go ahead.
Switch sides.
I think I'm gonna switch.
Just go ahead and ask.
She can say hot.
That's terrible. This is 58.
Like that.
Yeah, you don't switch.
No, like we gotta eat then.
A little bit.
Remember, therapists, your patient's shoes need to be under the bed. For this comp, the patient's gonna be sitting in a waiting room, and you're gonna have to bring them to the treatment area. Exactly.
Stop this.
Yes.
Yo, this guy don't pick up the fish pot.
Bro, won't you like therapist for 2 seconds?
Yeah, what, bro?
Which is why I already did it.
I had enough of that.
Like always want to be patient.
All right, guys, let's work through. If you are done, there's more to practice, meaning that pick something, Jose, and practice. I should not see any idle motion at all.
Are you fighting me?
No. You're gonna get more deviation on the other side.
That is true.
For extension, you have to use that. You have to put 4 fingers in the back.
Yeah, to support the palmar side.
Because of the style of process.
Because of the style of process, you're right.
Bernie, you have practice?
Yes, I just switched right now.
And then remember, slow like watching grass grow, please.
I'm not fighting.
How's it been radio reviews?
Yeah, I wanted to ask you about that, but I didn't have time
Or
anymore.
is it like
I would do the radio and all.
Radio.
Mucho. I was grabbing too much, no?
No.
It must have
Like
seen.
that.
radio? Yeah, it's like impossible.
Running late.
I was gonna tell you that, but I said, maybe.
It's just a new style.
No,
you
no,
know, it's-
because they have, show it.
No way.
No, that's okay.
That's what I'm saying. I was like,
Oh,
yeah,
yeah.
this is-
Interesting.
Why?
So I don't know if
What is the
they're.
normal infield for the wrist?
I guess they're fine.
New style. I
Oh,
stole from
and
my roommate.
that would be
He's Colombian.
firm.
Firm,
Yeah.
for all directions.
Yeah.
Colombiano.
What kind of infield are you getting
Ito
here?
Argentino.
Argentino.
No.
Cubana.
Warrants further.
So you should do like wrist exercises or something. Right?
Well,
No, it's a lot more than
exactly, there's something else going on there. It's
Yeah.
we
You know
have a
what's
bogey block stop.
Yeah.
Every once in a while, it starts
Great
to get
job.
really sore and I can't even like.
Interesting. So yeah, that's
So
something.
it's on and off, and now I guess I see why or something.
When I was.
I mean, this side's not that bad.
I don't know.
It's really just this
You
one.
get diagnosed here in the lab. Like, oh,
So you have, so this is considered what, a
Como se
normal or
le
an
llama?
abnormal infield?
The what?
When it was like,
They would slide off.
they slide off.
Oh yeah.
And
Because of my
sometimes-
shirt.
Yeah.
I didn't do it. Just-
Okay, so it looks like everybody's had a chance to practice?
Yep.
Okay, all right, we're gonna start with demos. All right, so Sam, you can have your patient here. You're gonna have to remove, and just make everything nice, please. Instruct your patient how you'd like to have them sit and lay. And Bernie, you're next, shoulder extension, and then George, you have the ABD.
And this is just PRN or OM, right?
This is
That's the
passive
thing,
range of motion as an exercise, that is it, just for shoulder flexion.
yeah. I'll be your patient. For this
I have shoulder extension flexion.
You have, Bernie, only extension.
Oh, okay.
Sam has only flexion.
Flexion, okay. And I have,
And yours is right there, George, ABD.
ABD.
And we're gonna go straight down the line.
Let's get it, let's get it, let's get it, let's get it.
more like the intro and everything? Okay.
You just wanna, and right now, you're just picking whatever shoulder you want, but you need to remember for the comp, left shoulder, right shoulder.
Okay, and then, okay, so I'm gonna have, I'm gonna cross my hands. And,
How do you handle your patient much more gently?
oh yeah. So, go like this, and then I'm going, as I bring the shoulder back.
You gotta cross it.
So it is like that. Oh, okay, that's what I was asking, like if cause I asked for a
Okay.
pronated grip here. Oh, okay, gotcha. Okay, now it makes sense. Alright, so as I bring the arm back, I'm just going to swing my leg back like this. Wait, no, like this.
In line with the
No,
motion.
I'm sorry, yeah, it was like this. Okay.
There you go.
Thanks.
Good. Passive range of motion is an exercise please perform 5 times.
Sure, okay.
It's number 2. How do you slide this hand that's on the elbow so that the lower portion of the elbow is supported when the patient's arm is here?
This hand?
Yeah, you want the cubital space supported.
Oh, okay, like this.
Go, start beginning position. All right, go ahead and move. Now support the cubital space. Slide your hand.
Like this? Oh, like,
Cubital space.
In position.
oh, I see what you mean, okay.
In position, good job. Okay, let's start again.
Yeah.
Let's see if we can get 5 smooth ones.
Okay.
Beginning position. That looks great, Sam. 1. 2, your mechanics are excellent. 3, you just have to just get more comfortable with it by relaxing your body as well, Sam, but it looks good.
Yeah. Feeling good, George?
5.
Okay. Perfect.
Patient, how does that feel?
Pretty good actually. Pretty comfortable.
All right, great. The only thing feedback I have on that is just to slow down, just to smooth down. Okay, awesome. Okay, all right, Bernie, your time to shine.
Sideline.
Shoulder extension. How do you pull this patient into a
Sideline.
sideline position based on where he is right now?
It is or?
Would you? Well, you could remove it, but usually we try.
I wouldn't have to.
No, you just
You
have
don't
the
have
chair.
to. I didn't remove it to move him.
So then, do I do the whole,
You're
Yeah,
demonstrating shoulder extension.
Just gonna reset them.
Right. Do pillow further up under the knee.
Further up?
The knee.
Make sure that your linen don't touch the floor.
Okay, so you take a look at your
Touch the
linen.
floor.
Oh, I'm sorry, I did not even see that.
Yeah.
My,
No, it's there, bro. No, it's there, bro.
All right, so talk us through it. Patient is in a
sideline position for shoulder extension.
Mhm.
And then, so I have to have, a
You have to-
supinated grip on the wrist.
Yes, before going, the patient alignment is important, right? So, is your patient in alignment?
So
His head
what I
being
have his
moving?
head a little bit more
A
extended.
smidgen more.
So if you could have your head on, lean back a little bit more.
There you go.
Right, just relax. And then my other arm would be at the cubital region. Alright. So then,
And your distal arm supports the wrist in what kind of position?
Is that Tai Chi thing?
supinated,
In a neutral wrist.
neutral.
Pos-
Oh, I think you're
position.
talking about me and what, like how I would hold it.
Or with a neutral wrist position.
So then I would just pivot backwards like this.
Pay attention to your patient. Are you pulling him out of
Yeah.
alignment as you? Oh.
Yeah. Here.
Okay, finesse. Think finesse. How do I not pull that surgical arm where my patient's yelling and screaming, but I'm handling with such care that it's skillful and my patient trusts me? So much that there's no muscle guarding, meaning they're not trying to help you and they're not watching every single motion that you make because they feel completely comfortable.
How was that looking?
No, I don't like
Still
it.
bad? So you're saying to just keep him here in this position without
Yes, but
just
I'm
move
asking you
his
to
shoulder?
handle him much more gently and
A
slowly.
little slower.
Slower?
Yeah.
Lower and gently.
Use a little back more too.
Okay.
Much
I
better.
like. Oh, a little too fast on the way back.
On the return.
On the return.
What's
Mhm.
forward, yeah.
So slow on the way back and then slow on the way
And the back.
on the return.
Excellent.
Good job.
Okay,
And
okay,
then slower on the return.
It's a little bit slower on the return. Try it again.
You're getting there.
Yeah. Slower on the return.
Reminding the surgeon.
Try stepping a little slower, dude. Maybe when you step back, just step a little bit slower.
little bit.
Slow.
Okay, can you try it again, Bernie? Try without lifting it.
And then bringing it down.
and putting
Yeah, it should be one.
One
Step
smooth
slower
movement.
when you go back.
You know what would help you on the way back doing slower? Push the arm first and then move your foot.
Push the arm
Like
Like
first.
when you
'Cause I'm kicking
forward.
when you swing your
You're
foot
pushing
when you swing your foot too early,
Yeah.
it's you're like pushing the whole
Just
thing
do
and you're
like
slow
slow
motion
motion.
too fast.
Go back in slow motion.
On your way back.
Step on
Yeah.
this
So just move your arms first on the way back, and then now your foot. Yeah.
side. Move with the arm like
That
slow.
works. Try it again like
Slow
that, and then
motion.
just do it slower.
That's a little better.
Mhm. Patient gave you some good feedback too.
Yeah.
That was
That's good.
good. That was better.
Better?
I would still work on speed. I would still work on planar motion of ABD. I'm still seeing a picking up and down like a rainbow with his arm.
So from my angle, that's what I'm seeing. So
Mhm.
from my angle, if you sit here, sit where I was, right there. So what I'm seeing is, I'm seeing kind of one of these, you see, versus just if I was the table.
Copy.
Try that one now with her feedback, Bernie. Bernie.
Maybe.
Try that with her feedback now. This is where we're
Try going
trying to
back
get the
slower, too.
finesse.
And then here. And then I'm not so far away from my patient. So my thigh is also my support here. Okay. What is that? Good direction.
All right, let's see what you got, Bernie. You're doing good. The feedback is,
You move
it's
back,
good that you're
slow-
getting the
do a little
feedback.
slower. Like,
Neutral wrist, supporting the elbow.
Close that table. There you go. And then slowly. That one's better.
And smooth
Yeah,
operator.
better.
Okay,
There.
there we go. Good job, good job, good job, good job, good job. All right. Awesome. All right, George, your turn. ABD, shoulder ABD. Who's your patient?
You messed up my arm.
I got you.
Agitation. So it's okay.
Can you get a better initial hold of your patient, please, without moving his surgical arm around?
Sorry. That'd be fine. Okay. With this one, that was mostly. And you would fall back into it. So you move the arm out slowly, while same time too, doing a small pivot. Bend your leg back a little bit to get an extra bit of motion, and then back slowly.
Okay, I like your motions as a therapist, but I'm still seeing restriction with the patient. So when he gets into the more of the ABD, can I see more of a rotary component to get his greater tubercle out of the way?
Okay, so
And then slow your pace down too.
like that.
Does he have more room?
Yeah.
Can you give him more ABD?
There you go. Yeah.
Yes.
I guess I gotta just go back a little bit more.
Mm-hmm.
That pivot foot that you have should be closer to his head.
That might be
Or a
helpful.
little bit more, yeah.
Okay, I'm gonna try like that.
Nice fix that.
That way you don't run his arm into your hip when you.
Your beginning position.
See and rotate.
In position. How could you get his arm to rest more on your forearm? At the end of that. Beginning position. Rotation. In position.
I would move the pillow too.
So there you want to do a little bit more of that extra rotation.
In position. In position. Actually, yours is even better than mine. Alright, let's see, moving out of the pillow out of the way, see if you can get more motion. Can you try moving the pillow out of the way
Oh, of
also?
course,
That
I'm
would be
sorry.
a verbal cue in the comp, the pillow being there. We'll watch you guys for a few motions, like a few rounds, and see if you can self-correct. And if we don't see the self-correction, we'll offer verbal cues.
Too much elevation.
Too much elevation.
Mm-hmm.
Easy there. You go slowly, 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 slowly. There.
It's
Now
good.
slow down your.
Mm-hmm.
Pretend you're holding your baby.
That was good. I would just go slower.
Okay.
Yes,
Well,
try
do
to-
one more.
try to-
Last
yes.
one.
You're rocking the baby to sleep.
Some people do this.
I know, yeah, I know. It's forgetting. There you go. Very good.
But keep your hands on the patient.
Yes.
One more time.
Neuroplasticity.
Okay. That works. Very good. Thank you. All right. Jose, your time to shine. Internal rotation. Is burning your patient?
Yeah.
I guess.
All right.
See how the work paper on Mr. Burn? Gotta rotate it.
So we got the about degrees, so internal rotation, feet like.
Beginning position. Therapist is in line with the direction of motion.
Thought I gotta do this.
In position. Shoulder stays, the glenohumeral joint stays at 90 degrees, and you're just letting it roll. There you go. Now there's the skill right there. That's where I see the skill. Perfect. Good. It is skillful. What you are doing is very skillful now. The speed is perfect.
One more?
One more. Sounds good. Awesome, Jose. That was great. Great. All right. Danny, your turn. Your time to shine. External rotation.
I was getting silly on my
Beginning position. Beginning position. Mm-hmm. End position. Beginning position. End position.
More.
Yes. Beginning position. End position. You're handling the patient's arm gently. I like that. Your speed is slow. I like that. But I would try and fix your body mechanics a little bit so that you look more comfortable. If you have to do 3 sets of 10, you're in trouble, right?
Yeah,
Turn the position of motion.
yeah, there you go.
Yeah. Be more confident about your body
It's like the
position.
staying alive thing.
A bit more natural,
Yes.
less robotic.
Yeah.
Right now you look like a mannequin.
Alright.
So stand in line of the motion that you're gonna go, and then just. So if I had to do 3 sets of 10 here, I'm fairly tall, but I'm comfortable. And then it's moving me forward.
So you don't have to rotate for this one?
I'm sorry?
You don't have to rotate for this one?
To rotate? No, because when you're at 90, you're actually taking the tubercle
Okay.
out
I think it's
from
to perform it, so how's the patient look after this one?
Oh,
Yeah.
is it does the therapist have to rotate?
No, I'm saying that I didn't get the performance, so I didn't know.
Yeah, you're at 90 degrees, beginning position, okay, end position,
Okay,
beginning position,
so you do have to say,
end
okay.
position.
You would rotate if you go all the way.
Beginning position, yes, end position. And your patients
Well,
are gonna
looks
be
like you're
different. We've
rotating
had some
this.
students in the past that have been so hyper-mobile that like you're like turning and then you're also, with the legs bending too. So it all depends on the patient.
It would be like, you would turn it.
Yes, that's
Okay,
what
so,
that's
alright.
exactly what I meant.
Okay, cause I saw that, okay.
Okay, all right, so good job, Danny. My feedback to you, Danny, is have it flow more. So yours is more, your speed is great. Speed is great, right? I love how you're handling the patients. That's great. All right. My only thing is have it with more finesse where you're less robotic, but it flows more. That's gonna require you to tap in a little bit more into your patient, right? Meaning like, how's his arm flowing? It's like you just wanna flow with that. Okay, that would be the only feedback.
I also thought that Benny's a little stiff too.
He is. He
like,
is. Yes.
No, I got to here,
Mhm.
and then I instantly started feeling some tightness.
Mhm.
So then I went back and I went a little less. I still felt tightness.
Yes, you're gonna find he's got some areas where there's some stiffness. You're right. Okay, Claudia, your time to shine. Horizontal A, B, D duction. Horizontal A, B, D duction. Ah, look at that. That's her beginning position.
Yeah.
Okay, let me offer some feedback before you continue. What does your patient need to do because you're going more into ABD duction?
You want me to put a little? Oh, okay. Can you move closer to me?
Yes, of course.
There you go.
Okay.
You want room for that shoulder cup to open into ABD duction. Good. Beginning position. Drop it more ABD. Drop the elbow down. There you go. That's it. Good. Beginning position. Your hand should just slide. You shouldn't have to remove it. Just slide on and off. There you go. Perfect. Mm-hmm. Beginning position. End position. One more. Beginning position. And end position. That was perfect. Thank you. All right, everything was great. Your mechanics were great, speed was great. When you finally opened up the drop for the shoulder cup to open at its anterior capsule, that was wonderful. It's great. All right, Gianni, your turn. Horizontal ADD duction.
So my starting position.
Okay, we're just going to do 3 reps moving on out for everybody. Just 3 reps, everybody.
Alright, my starting position is going to be right here.
You're doing horizontal A.
A, B, A, D, D. My bad.
Got it.
Okay,
So where's your start?
This is the starting position then.
Yes.
So we're gonna move on here.
Okay, try it again without moving the elbow so much. Should the elbow and the arm should fall, like move together. Try it again.
Just completely relax. Just close your eyes if you need to.
Can you support his forearm more? You see he's guarding you, right?
Huh?
Is he guarding you?
A little bit.
I can tell.
Yeah.
So how do you guard him more when your patient's guarding, right? So if I may.
Use my forearm a little more to support his.
And then you're more like this pushing motion.
Oh, yeah, I like that.
Okay. And I will bring his arm slower. Because I'm getting a little bit of
Keeps moving his tail with his pillow. And the sheets. They'll learn then.
You feel the difference, Bernie, in terms of
Yeah.
like how I'm making sure that you feel that I've got you,
Especially.
right? So you can completely relax.
And that's just when you put in that your forearm there just so you can rest more.
Yes, because he is guarding, he's helping, he's assisting.
So now this time instead of grabbing on the wrist, we're just grabbing in the hand.
Just like
Better?
resting on the, you shouldn't be grabbing on the hand. So I see he's grabbing on the thumb, but you want more
Like
of a
this.
neutral wrist, yes. See if you can do the same of what you were supporting, Gianni, at the end there, but keep still your hand like a neutral, yeah. There, that's it right there, that's it. Okay, good, and toe heel up, good job. All right, very nice, Gianni, that's looking good. Gianni, you're still your time to shine for elbow flexion. You have the flexion of the elbow.
Yeah. Okay, so, palm up.
Okay, can you try and handle your patient a little bit more with finesse?
Yes,
Mhm.
of course.
Okay, beginning position, end position. Neutral wrist, beginning position, and neutral wrist with the end position too as well. That's it.
You pivot the feet in this one too.
He should be.
Do the staying like it.
Okay, there you go. Should be here and here.
Still don't understand. Still don't understand.
Dorsal surface, palmar surface,
I
right?
don't know why it's called that.
There you go, right there. Dorsal surface, sleight of hand, palmar surface. That's it, Gianni. Good job. Good. Just go a little bit slower. He just had surgery, and
We gotta be careful.
yes, he just had Z-plasty of the biceps, right? Z-plasty is a surgery that goes in the letter Z shape. It kind of does a zigzag, and so we have to put do passive range of motion for the biceps. That's it. Alrighty, okay, good, alright. Just want to keep your wrist neutral. Alright, great. Claudia, your turn again. You're coming up in, Claudia, elbow extension for you. Okay, so your beginning position is where? That's right, in a flexed position. Plan of care might say elbow extension. You're starting in a flex position. Good, beginning position. That's it. End position. A little bit more rotation, less from your back. Beginning position. End position. Good job. Last one. Beginning position and end position. All right, that was great. That's perfect. All right, next one. We're going over Danny. Forearm pronation. Y'all can take some cues from Danny. He's one for attention to the little nuances of detail, right? Those little things. So what he might, others might miss, he sometimes catches. Right? That's right. See, I'm neutral position. End position. Neutral position. Good. Beginning position. Good. What do we think about his speed?
Be a little slow.
Could be a little slower.
Just a smidgen.
Patient hasn't fully gone to sleep yet.
Because he's relaxed. The boy heavy.
No, he ain't relaxed. He's healthy.
Was it fruit?
And physician.
Good job.
Yeah.
All right. Good job. That's perfect. Thank you, Danny. All right. Say your time to shine for supination.
Squat. I don't know that.
Neutral position. End position. Beginning position. End position. What I would offer is as you're moving into your end position, can you keep the elbow, like I should say the forearm, right? Keep that in pure 90. So it's like this instead of me seeing like a this. Yes. That's it. Beginning position. End position. All right, one more and you're good to go. Beginning position. And end position. All right, good job, good job, good job. Great. All right, your time to shine, wrist flexion.
Oh, yeah.
Wait, you go line, I don't know why. I see you do both deviation.
Yeah, I'm refining that.
All right, so wrist
So
flexion.
this
yeah.
one will have patients on neutral, relax.
There you go. Very nice. What would we offer for feedback for him?
He's not moving. He's sitting up straight. So you feel like forcing a little
He's
bit.
doing, wrist extension?
Flexion.
Flexion.
Right.
His body mechanics are good.
Oh, yeah.
Arm is stable. Motion is in the correct direction. He's in line with the direction. What else is there?
I think
Speed.
it's good.
You got
A little slower.
it. Yeah, it's a little bit slower. Carpal tunnel. That medial retinaculum. You have your flexor retinaculum and extensor retinaculum. Those are like really gentle, for their patients. They feel, especially for your older patients, that bothers them. So you have
Like
to just
that.
go super
Go
slow.
like that.
That's good. Actually, that's excellent. That's good. Yeah. All right, wonderful. Thank you, sir. All right, Bernie, your time to shine.
So I do it on myself?
This one's a little difficult to do on yourself. It's gonna be up there.
That was very. Yeah, you gotta change the thing.
Yeah, you really do.
Yeah, we said it.
Yep, let's change it. Let's change it. Come on, guys. You're on video.
Oh, it's a video.
Yeah, I missed it.
What?
Claudia
Maybe
saved
we
the day.
should,
Right here, look, right here.
You missed that.
Yes, let's count. I missed it.
Thank you, Claudia.
You
Was that on camera?
You got this dirty dog.
I'm confident too.
Yo, why does the therapist have their shoes off? Bro?
Chill.
Yo, that's unprofessional.
Chill. Damn. My inferior scapula, dog. Like, no BS either, but that's it.
And I'll go over.
Bro, I just got moved to like 17 different positions, bro.
I know you.
Oh no.
Pause.
Alright.
Thank you, Claudia.
Minimal agitation. During the comp, these sheets cannot drag on the floor, not even for a second. Okay.
Would you rather get new ones?
Yes,
Oh.
because
We
he
touched the
literally
floor.
just put a dirty sheet over by your head now, by your chin.
Dang. Come on. Not even know my feet.
Yo, nah, come on now.
My beat, bro.
You feel one of my feet, dude.
I didn't even know this, bro. My beat. What do I got? So it's
Alright, you
You got
have
ready.
wrist extension.
wrist extension.
That's right.
So
Bernie, mind putting your shoes on?
yes.
Probably have better stability if you do that.
It's extra comfortable. Very true.
Afternoon nap.
Yes, it will.
Yo, Bernie.
You're not covering the feet.
Pillow, dog.
Mhm.
Facts.
Sanitize your hands.
Factoids.
And you need a
Sounds
pillow
like
today,
You know
so.
what I was talking about.
What was the pillow? Was this here?
Here you go. Here you go. Back to you.
No, and this Liscano was praying on your downfall.
I'm saying,
man.
but he was holding on to it.
Very
He was
important.
hoping.
Let's get her.
Bernie, you
Bernie,
you
the
you
pillow
were
was
supposed to
One
show
more
one,
time, Bernie.
Yo,
In the
One
corner.
more folder right now,
Yo.
boy.
No, we're good. We're
Because
good.
they had just told me to put it higher than how I normally do.
Nah, that's fine.
You're good now.
But,
So extension.
Alright, so you're moving into wrist extension.
Mhm.
Alright, well, usually when the hand is going down or the elbow's going down, we usually try and make sure we have our hand on the bottom. So how would you give more of that digits 2 through 4 to support the
you
dorsum of
can
the
grab it
wrist?
with your
Switch your hands with
left
it.
hand.
That's right.
Here.
Switch
Danny
your
said
hands
switch
with
your
it.
hands.
And switch.
Alright,
I get over on this side.
Yes.
Stop.
No,
Put
one
this hand.
hand.
Put this hand like that.
You always want
It's
your
like
hands
a
super
massage
neat.
or plane. You always do it.
Like this.
alright.
You always want your hands super neat, bro.
Now, patient, please give him some feedback.
Alright, bro. Dear buddy, hold up my hand. And
Better there?
hand slow.
Mm-hmm.
Do you have to hold the hand for that, or you hold the wrist?
He's holding the forearm, which is good approximately,
Okay.
and he has his hands in between, like the hand and the wrist, if that makes
But
sense.
the thumb has
So
to
it's
be on the
across the
hand.
joint. Yes, it's
Okay.
gonna need to be. So patient, do you feel a difference in terms of your patient has you a little bit more cradled and better positioned?
Yeah.
Okay. So patient should be more comfortable. That's great. The only thing I would say, Bernie, is just slow that one down.
Slow it
so
down.
You have the mechanics of it. Okay, good job. Okay, the last one, Sam. Can do the radial and the honor deviation.
Okay, so this,
Can you handle your patient more gently, please?
like this, and then for the radial deviation, I'll turn his wrist like this.
There you go. Claudia's showing you lumbrical grip.
Oh, nice, so like
Your hand should like lump with the lumbrical. Maybe it's just one more. Yes. Okay, now you got it. Yes.
Right.
Lumbrical is
Yeah.
literally contact surface, not.
Yeah.
You got it. You got it. There you go. Good. And then how would we do the honor? That was perfect.
So I'll switch.
How would you gently handle your patient with all that
Oh,
switching?
sorry. So this,
Mm-hmm.
this,
I like it. Neutral wrist, and you're moving into the honor deviation. Therapists in the room can see that the arm is stabilized on the mat, which is good. You're also holding it approximately stabilized. And your speed is now looks really great. Wonderful. All right, thank you, sir. All right, before you mind standing for just 1 second, I just want to wrap up lab with this now. All right, this is not for practice, but just so that you guys can see demo in terms of fingers. We were able to get the shoulder today. Good job, guys, in getting through that with the elbow, the wrist. For the hand, it's just a demo. So if you remember in kinesiology, we talked about the MCP joints, right? Literally, if I'm working on the MCP joints, I'm stabilizing now at the wrist, keeping the wrist in neutral, still a lumbrical grip, right? So wrist is in neutral, and I have the pads of my fingers. All of my surface contact is on the patient's palmar surface, and I'm just bending into flexion. You want to try and keep the fingers, dips and pips extended, right? Beginning position. Just relax your thumb and relax your hand. End position. Beginning position, just try and relax. Patient wants to help me. All right. And end position, that's MCP. You won't have this on the comp, but this is just so that you know. Now, in order for the proximal interphalangeal joints, I have to stabilize the MCPs, so I have my hands across where he's not going to be able to flex at the MCPs, right? But my distal fingers are, or my fingers are, sorry, on his distal fingers for flexion of the PIPs. Beginning position, end position. Beginning position, end position. If I can get like a lumbrical, that would be fine, but it's really hard, so I'm just kind of more grasping like this so I can get pure flexion, right, of his dips. Now the dips, I slide my hand up for stabilization, stabilize the pips, and only flex the dips. Beginning position, end position, beginning position, end position. We have to kind of just do the pinky by itself because it doesn't follow, okay? All right, the last thing I want to show for you as a demo is the D1 flexion, okay? D1 is the yummy, right, flexion. So watch my position, watch me.
This one's
This is not on your comp, okay? It's gonna come back again during Therex 2. We'll be revisiting this, but you're gonna be practicing because you need it for rehab, okay? Beginning position. Patient relax as much as you can. End position. Beginning position. Swooping down. Yucky, I don't want it anymore. End position.
So it goes from supine to prone, right? From supine here, and then it goes to prone.
Supination of the forearm? Yes.
Yeah.
Mhm.
Exactly.
To pronation of the forearm. It's always going to be the opposite, yes. That's D1 flexion. D2, relax for me. The D2 flexion, this is the beginning position. Okay? Beginning position, D2 extension, sorry,
Supine.
extension. Now the shoulder is in relative flexion. See how I'm using my body to control where his arm goes and supports? Supported as needed. Okay, in position. How does that feel, patient?
Pretty good.
Smooth from beginning to the end? That's what you want to try for. Beginning position, end position. Okay, so it's D1 flexion, D2 extension. Let me show you the lower extremity because I don't know if I'm going to have a chance to show you guys next week. We'll be picking up a little bit faster. All right. D2 flexion. I'm sorry, flexion. All right. Here we go. Beginning position. End position. Beginning position. Okay. End position. In the way that my sheet is draped, if someone is standing at the foot of the patient's bed, no one sees what's happening between the legs. Right? Beginning position. End position. Beginning position. End position. Okay, and D2, flexion also. Beginning position, in position. Beginning position, in position, okay? All right, just a demo for you. We'll revisit this in therapy. What happened, Bernie? What?
That like I don't know, like I feel like it's a lot for me. Like all that, like the pivoting, I feel like I don't know, like it's the motion of it.
It'll come back to you in
I'm
therapy.
saying it's gonna be in the video, so you can see it.
Yeah, it's in the
I was
video.
saying that too.
But don't worry, this is not part of your comp. This is not part of any particular